Welcome to the Fact of Lounge podcast, your Dalhousie Medicine New Brunswick podcast. I'm Dr. Sarah Gander, a pediatrician and your host, and here we are today with Dr. Katharine Smart, who I'm so excited to talk to today because not only is she a fellow pediatrician and a fellow social pediatrician, but she is also the president of the Canadian Medical Association, and frankly, just a badass lady that I love knowing and love talking to and love following on social media. So welcome, Dr. Smart.
Thank you so much. I'm really excited to be here with you too. I feel like we're two peas in a pod.
I know. Well, I just got back from the Canadian Pediatric Society meeting where I got to see you do your keynote speech, which was awesome. Thank you for the social peds shout out.
Thank you. I was so excited to give that presentation and really honored to address my colleagues and especially people like you who are experts in this field and I'm always learning from as well. So it was really a lot of fun to see people and make those connections.
Well, I almost think that you can't even think of ourselves as experts because things are changing so much all the time and we're learning so much all the time. But so I will throw that compliment back to you and say I've learned a lot from you, especially during your course here as CMA president. So, I don't want to jump into all the like super heavy stuff right away. Like, let's just, how are you? How was your day today?
My day has actually been lovely. The sun is out in the Yukon, which is an anomaly. And I actually had coffee on my deck before my day started. So that was wonderful.
So I should have said at the beginning too, that so you live in Whitehorse in the Yukon.
That's right.
But you were trained as a pediatric emergentologist and lived in Calgary, is that right?
Yes, that's correct. I did my residency there and my fellowship there, and I was on staff for several years in the emergency department at Alberta Children's Hospital, which is where I really learned, I think, most of my clinical medicine, the actual physical medicine, maybe less of the mental health, social medicine that I now practice, but it was a wonderful place to learn how to be a pediatrician and look after sick children.
Yeah. And then but is Whitehorse home for you? So you're like, I'm going home, or you just like were traveling up north a lot and then fell in love?
I had actually never been to Whitehorse, and I was invited up here to teach a course called ACORN, which I'm sure you're familiar with, but for our listeners, it's a neonatal stabilization course. And that was 5 years ago. And after my 4 days in the territory, I thought I should move there and came home and told my family, and we relocated here a few months later, and we've been living here for 5 years. What
did your family say when you're like, let's move to the Yukon?
Well, my husband asked me if they'd given me some bad drugs while I was here, and I said no, there was no drugs involved. He was a little bit shocked. My kids were quite young at the time, so they were sort of like, okay, sounds good. But yeah, after we talked it out more and I sort of explained my reasoning, and then him and I came up for a visit together for him to check it out too. He's also a physician. He's an orthopedic surgeon, and they didn't have that service in the territory either. So we sort of decided it would be a fun adventure, and we sold everything, bought an RV, and drove to the Yukon.
Oh my gosh, you guys are so fun. How old were the kids then?
Oh, good question. They would have been about 7 and 5.
Oh my gosh. And so the older one were they both in school and so then they changed schools?
They were, they changed schools, and we were really lucky they were able to be part of this Montessori school here in the territory, which has been amazing. And I really saw, honestly, the dividends of that in the initial part of the lockdown because my kids were like super independent at doing their schooling, which I think is something they learned at Montessori. So that was great. And my daughter is now just completing her first year at high school in grade 8. So she just did her third ever real exam this morning. So that's where we're at.
So the realities of like real life are obviously just like all of us there in the background when you're doing all these other kind of wonderful things. Is like at the end of the day, there are exams and puberty and whatever else is going on.
Yeah, oh, absolutely. And, it's so interesting, right? Like as a pediatrician, like living out the experience of parenting is very fascinating. And it definitely keeps me humble and gives me a lot of empathy for parents. It's not an easy job.
Oh, no. Amen to that. So as a pediatrician, are you the only pediatrician in Whitehorse? No.
I am not. I was initially. So when I came here, that was part of the motivation to move up is at that time they had a visiting pediatrics program and there was only 4 days of pediatric services a month in the territory that were regularly scheduled. So when I came, I was the only pediatrician working here full time and providing on-call services for the first 2 years. But since we've recruited and we're now a group of 4, so that is much nicer.
Oh, absolutely. Except for you could be like Mike Dickinson and Miramichi, and it's like if you're the only one, then you're available when you're available, and you're not when you're not. But maybe if there's 4 of you, then you feel like you have to cover everything all the time.
Yes, we do now provide full call coverage, but I think, as we all know, in theory, it sounds good to say you're not available. In real life, when people call for your help, it's a bit harder to have those boundaries.
No, it's so true. And I remember I had a mentor here who worked in St. Martin's, which is just a little like fishing community kind of close to St. John. And he was the family doctor there. And so if it wasn't, somebody coming up with like chest pain to your door at night, it was like they were bringing their dog that got shot by mistake or something. And so, because you were like the town doctor. So I could just imagine that there's not a lot of privacy too at times, maybe if you're in a smaller community.
Yeah. And I think it's like anything, right? Everything has a pro and a con. Like, it's kind of nice that people know you and you have those relationships and you go out in the community and you get to see kids that you look after just living their lives and doing normal things, which is really lovely. But, of course, the flip side of that is sometimes it is hard when everyone knows you, and often you can become the topic of conversation for people and everyone's curious about your life. So it's a blessing and a curse, like many things, I would say.
Oh my gosh, I remember becoming staff and coming back to St. John, which is my hometown. So I grew up here and know a lot of the people here. And all of a sudden a patient said, yeah, I saw you at, such and such a place, and you like red wine, do you? It's like, oh, okay. All right.
Yes. No, it's true. You kind of know you're a little bit always on display, right? So it's
on your best behavior. So what would you say is sort of the path that then took you into some of these leadership roles? I think I saw that you were you were the president of the Medical Association in Alberta. And is that kind of how you started your leadership life?
Yeah, well, it was the Yukon that I was the president of the Medical Association. So after I'd been here for just over a year, it's interesting, right? In a small place, you can imagine the Yukon's a small territory. There's only about 80 doctors. So there's a limited pool of people that want to step into these leadership positions. And I'm obviously an outspoken and bossy type personality. So I think after people had gotten to know me here and they needed a president for the Yukon Medical Association, they were like, oh, her. So I sort of got like voluntold into that job, as people do in small communities. It's not always like super competitive because no one really wants to do these roles. But I thought, okay, my lens for any decision is always, does it align with my sort of core values and the things that I want to do and the bigger picture pieces of what matters to me? And I thought, okay, well, it's again a chance to work with the government, a chance to bring about change, a chance to advocate for patients and colleagues. So I thought I would go for it. So I did that. And then, of course, the pandemic happened. So that made that role also quite interesting. And then, while I was in that role, I got more familiar with the Canadian Medical Association because there's a lot of interactions between the PTMAs and the CMA. And that was really interesting. Got to meet lots of medical leaders from across the country, as well as the CEOs of some of the bigger PTMAs. So that was really interesting. And then it was the Yukon's turn to have put forward a candidate for president-elect. So I decided to put my name in the ring for that election. And that's how I landed here.
Oh my gosh, that's an awesome story. I mean, I think there's so many take homes, like getting involved in your provincial medical society. Did you feel like you made some meaningful change? Like, I know it's incremental, right? Like sometimes you don't get to see the fruits of some of the seeds that you plant.
Yeah, no, I definitely did. When we started, we were able to kind of reinvigorate some of the conversations and tables with the government to advance some of the key priorities that we had as a territory. But I think probably the biggest role I had was honestly during the pandemic, because, when the pandemic started, very rapidly, we had to pivot the whole medical community into a different direction to make sure that care wasn't interrupted. So I was at those tables. I was the one that sort of was able to negotiate the switch to virtual care, pick a platform, get all the doctors on it, get the government to agree to pay people to provide virtual care, and make all that happen. Really, it was in sort of a 24 to 48 hour period that was all accomplished. So I felt really good about that, because it meant that patient care wasn't interrupted and physicians were supported, and and people were able to keep doing what they needed to do. And then, from there, a lot of my work became supporting my colleagues emotionally, providing opportunities for people to connect, creating virtual experiences so we weren't totally disconnected as a medical community. Because, during those early months when we were really locked down, it was very isolating. As I'm sure you remember, there was so much stress about the unknown for providers. What was their risk? How were we supposed to care for patients? What did these protocols look like in our hospital? So I was at all those tables with government, with public health, with my colleagues, really trying to work through those challenges. But at the same time, with that eye to how do we support each other emotionally? Because it was, I could really say I don't think I've ever seen colleagues so stressed as those early days when there was just so much unknown, and really they were facing potentially a lot of personal risk. So that was a really interesting time to be in a leadership position.
Absolutely. I do remember. And I was the department head here of pediatrics at that time, which would have been on a much smaller scale than you. But you're right, just even trying to get information, to have that information be clear. And so, you described yourself as bossy. And because I happen to know you also went to the Canadian Women in Medicine Conference, I am going to draw our attention to the fact that we're, that is a good thing, right? Like pushy, emotional, aggressive, that's what we need in leadership.
I think we need to, absolutely just embrace the reality that it's not bad to be assertive, right? It was like when you introduced me, you said, oh, she's a badass woman. Like I take that title with pride. I think more of us as women need to lean into those things and feel, not have to make ourselves smaller than we are, right? And I say bossy, of course, a little bit cheeky. I, of course, try to be collaborative and work with other people, but I think I'm not afraid to give my opinion. And I think over time, what I've learned is, we don't always have to take the rules that other people have made for us. And I think sometimes being willing to challenge things, challenge the status quo, and sort of stand up for what you think can make other people rethink how they're seeing a challenge, right? And I think when we always feel like we have to make ourselves smaller and conform to the way things have always been done, we lose those opportunities. But I think we all know that the challenge of that is especially when that work challenges other people's power or other people's perception of how things can be, you can sometimes be labeled as disruptive or difficult because you're making people uncomfortable, right? So I think all of us, this is what's so great, right, about connecting with other people in leadership, other people that have different perspectives on what our healthcare system could look like, how we can lead, so that we can get that support, that it's okay to sometimes create a bit of discomfort, because change only comes through discomfort, right? If there's no tension, nothing will be different. And if we want things to be different, we have to get comfortable being uncomfortable. And we also, I think, have to get comfortable sometimes being the person who makes other people uncomfortable, hopefully in a kind and curious and supportive way. But we've got to embrace all those emotions.
Yeah. And you used the word earlier when we were talking about patience, about being humble, that curiosity and that humility is so advantageous in our leadership roles, because then, people ask for innovation all the time. And I don't think you can have innovation without risk, but like the medical system is so risk adverse that it leaves us in this difficult place. So I always see it as our roles as leaders to find that edge. Where are we uncomfortable? Where are we going into the unknown that might actually mean that we can make meaningful change?
Yeah, I totally agree with you. And I think humility is also so key, right? But I think, again, you can be all those things, right? You can be assertive and humble. To me, humility means you listen deeply to what other people say. You don't always assume you're right. You're always looking for a new perspective or a new way of framing something, a different lens to look through. And you're constantly learning rather than showing up assuming you have all the answers. And I think the best leaders try to always take the best from the people that are in the room and aren't afraid to be challenged and aren't afraid to change their opinion. And I think we all need to be able to embrace that, especially right now when there's so many crises that we're facing.
Must be a challenge as a pediatrician too, because I would think myself, my brain as a pediatrician, I obviously think about kids and youth and, the social determinants of health so much and things. And then you're in a leadership position where people are saying like, we need PPE, we need OR time, we need, things that like are obviously important, and you can easily put yourself in that position. But do you ever find yourself thinking like, oh my goodness, how am I going to spread myself around trying to understand all these places that you don't spend a lot of time in?
Yeah, it's true. Of course, you know best what you do, but I think that brings up another key skill, which is delegation, right? Find other champions, find other people that want to work with you, leverage their knowledge and expertise, and make sure you're listening to the right people. Because I think, so often what goes wrong, I think, in big organizations, and I see this happen a lot in hospitals, is they're not asking the right people the right questions, right? If, you got to go to the on the ground frontline people and find out what's happening. What are the pebbles in their shoes? What's not working? What is working? And so often we make assumptions about other people or their roles or what they want or don't want. And I think that leads to a lot of the conflict or frustration or lack of success. Whereas if you just take the time to actually identify who knows and who's doing the work, and you're curious enough to actually listen to what they have to tell you, you're probably going to find a lot of solutions.
And maybe even people who want to help you find those solutions in a collaborative way.
Oh, absolutely. It's about growing your team, right? It's none of us are going to fix these things by ourselves. So it's about who wants to get into the arena with you and do the work. And I think, when you create the right environment, there's lots of those people.
Have you had to leave home a lot in your CMA role?
I have been lately. Of course, most of my role as CMA president has happened in the corner of my basement, virtually over Zoom. So I have a little corner set up here with my, lighting and background and all those things that you need these days to be on TV and in these virtual meetings. And I'd say up until recently, that was most of my time, full days down here doing that. But fortunately, since things have opened up a bit more, I've been able to travel to events and meet colleagues and give presentations and be at meetings. And that's been great because it's been so reinvigorating just to make those connections. And again, to me, it's part of that humility and that learning. Every time I'm in an environment with other people, I'm taking so much away from what they have to say and the way they see things, and getting that as new framing, new ideas, new language. And I really enjoy that. So it's been really nice to be able to make some of those connections and have the opportunity to see people in person in the last few weeks and months.
So you also at the CPS meeting, challenged us to really get out there on social media, because that's something that you do quite a bit, and it's something kind of new you brought to the table as CMA president. But was that out of necessity because of the pandemic, or is that just you anyways?
Good question. It's funny because when I put in my sort of papers to run for CMA president, part of that process is you have to sort of say what do you think about the CMA? How do you understand their strategic vision? But also, what would you bring as the president? What are your sort of ideas? And that was, of course, pre-pandemic, pre all of these things. And that was actually one of the things I said. I thought that the organization could have more of a presence on social media and try to use social media a bit more as a tool to engage both with the profession itself and with the public. So I had that interest. Now, at that point, I hadn't really been a super active person on social media. I'd say I was like your, typical person engaging more with people I knew. But I did think that would matter. And then I think the pandemic really just kind of put that idea on steroids, right? Like suddenly it was very clear that we were battling not only COVID, but a parallel infodemic of misinformation that was really harming people in a very real way. And that there was a huge need to be on these platforms combating that misinformation, but also importantly, spreading good information and making sure that the public was hearing accurate messaging. So that really sort of encouraged me to ramp that up. And then, of course, I'm fortunate, right? When you have a title like president of the CMA, it does give you a platform. It gives you opportunities in traditional media that then also give you name recognition that helps you on your social media. So I really felt like it was an opportunity that I wanted to leverage for good for people. And if I've learned anything in the last few months, it's just been the importance of recognizing the risk that misinformation poses to the public and the need for us to be in those spaces to combat that.
You have over 18,000 followers on Facebook, right?
On Twitter. I do now. But when I started, I only had 1,000. So I've it's gone, so it's been fun seeing that kind of tick up over time. And yeah, I'm grateful to have that audience. And, honestly, I'm so grateful for the connections I've made with colleagues on social media. That's the other piece of it. Of course, we all know there's the dark side to social media, the harassment, the nastiness. But that's going to happen. But there's a lot of positives too. And I have met so many amazing colleagues on social media that I feel like I now have a relationship with, or I've been able to then connect with in person. And I've also learned a ton from colleagues on Twitter, like just the way people frame things, different things people say, articles people share. Like I've really found it really a wonderful place to exchange ideas, to learn, and just start to feel connected to people. So I'm really grateful that I've had the chance to engage there, because I feel like it's been useful in terms of trying to do my job, but also personally quite rewarding in terms of the people I've been able to meet.
Yeah, I once went to like a social media like talk at a conference or something, and they were talking about the different platforms, and Twitter is like a waterfall, and like you're not meant to consume it all. You're meant to just sort of like, dip your mug in there and get a mouthful every now and then. And I find that that's what I like Twitter for, is that sometimes things come up that are so interesting, but then you kind of have your favorites. And you keep going back to some of those favorites, and so you probably think I'm a little creepy and stalkery, but you're one of my favorites, and so I'm always watching your stuff, and so it is nice to see that consistent message, that person who you can relate to, that person that you admire, and then I think that a lot of us kind of lost that in the pandemic when we weren't around other people, so it was so nice to have a consistent face.
Oh, well, thank you. That's very kind.
How'd you know what your messages were going to be? Like, is that how you are? You're like grounded in your message. You knew what it was going to be. Do you ever change your mind or waver?
Yeah, great question. I thought, quite a bit about that, especially when I first started, because it's an interesting thing, right? Like you kind of have to decide where you want to position yourself and how you want people to perceive you, and sort of what persona you're going to put out there, right? Because there's lots of personas that you see on social media. And the reality is you're projecting a lot about who you are in the way you communicate there. And I think, you have to kind of decide, like anything in life, what that's going to look like for you. And you have to, I think, again, kind of come back to those core values types questions about, what am I going to do and what am I not going to do? Maybe that's more important, is what am I not going to do? So I think, what's so potentially dangerous about social media is it's always there, right? So you can easily tweet or respond to things kind of out of anger or frustration, and that you might then regret that later. So I find you really have to be thoughtful about what you're putting out there and making sure it's what you actually want to say. But I also think it is an opportunity at times to challenge things, to be bolder, to point out inconsistencies or things that people are doing that you don't agree with. Hopefully not in a attacking the person way, but kind of in a pointing out why the ideas are concerning way. And I also kind of decided early on that is also matters to me. Like I'm not a person who thinks we always should try to walk down the middle on things. I think sometimes we have to take a stand and say things that are maybe more challenging or pointing out things that are not right. And that matters to me as a person. So I was like, that's going to matter to me on social media. But I also think it's important to be respectful. I think what I don't like on social media is when it gets really about people attacking each other as humans and almost bullying behavior that we're sometimes seeing now happen. I don't think that's very productive, and particularly when it's happening between professionals who don't agree about something, and it kind of almost deteriorates into like a high school battle of people calling each other names. And I'm like, I'm not really sure how productive this is, and I don't think that's how we would communicate with each other in real life. So I think we need to find a way to disagree respectfully and kind of come back to those, the fact it's about the ideas being put out there. It's not about the person. And sometimes I think social media deteriorates a little bit in that way. So I've tried to walk that line of sort of saying what I think, calling things out when it concerns me, but also trying to be respectful, because I don't want to kind of engage in that type of sort of bullying behavior that I unfortunately, I think is starting to happen.
Yeah, and it's a nice balance too, I find, when you can be playful and fun and like also include the joyful things that are going on, because that's the nice balance about following you, is that there's always a nice sort of balance of your personality that's light and then also, you're very like passionate. What do you call yourself in your excessive passion syndrome?
That's right. My self-diagnosis, hashtag EPS, excessive passion syndrome. Yes. And again, like many things, it's a pro and a con. So I have to be careful about that, but it's also sometimes good. So, being self-aware, that's important too.
Yeah. And having kids nearly in high school, did they call you out on your social media stuff? Like, oh God, Mom, don't embarrass me.
Yeah, no, it's interesting. My daughter now has a phone. I let her have a phone this year, but she's not on really any social media. So that's good. But then when I try to brag to them, when I try to say, hey, guess what? I have 18,000 followers on Twitter. They just look at me like I'm so lame. They're like, Mom, like, you're not important at all until you have at least 1 million followers. I'm like, oh, okay, fine.
Do you consider yourself an influencer?
Yeah, exactly. I'm like, clearly not according to their standards. So it's quite cute because they keep me in my place as well. It's hard to impress them. That's the bottom line. So thank you for your kind words about me because I'm not getting it from my kids.
Well, anytime, because the other sort of phrase that, is going viral, if you will, amongst the like Dr. Smart fans is the comment you made about being a psychiatrist by day and an intensivist by night. Did you have that already ready to go, or did that just come out?
Oh no, it was so funny that when people started coming up to me about that saying, because I've been saying that for years. Like I started doing Northern remote pediatrics. In fact, the first thing I ever did as a staff, like as a consultant pediatrician when I had my full license, was work in the North. So I have walked that walk for a long time. And I've always said that. I'm like, wow, this like rural pediatrics is a really kind of nutty job in a lot of ways because of that fact that you're psychiatrist by day, intensivist by night. I mean, there's not, I think our rural family medicine colleagues would share that experience, but certainly not what internal medicine folks are doing. I don't think they do a lot of mental health care. They're much more focused exclusively on physical medicine. I think pediatrics is a unique specialty because it really covers all the aspects of children's health. So I've always sort of thought that, and I thought everyone said that. So I was sort of surprised that was unique. But I have since pursued, after people were into that phase, I'm like, this might be a fundraising opportunity. So I've actually found a Canadian t-shirt company. I'm going to get that quote on some t-shirts, and then we can buy them as pediatricians and donate the money back to maybe Healthy Generations.
Oh my gosh. Well, if you need any help, you know where to find me.
Yeah, I think it could be kind of fun.
Oh, it would be so fun because, I was going to kind of go into this interview with like, okay, psychiatrist by day, intensivist by night, like leader all the time. And like, now I'm like, oh no, now influencer when she's not around her kids.
I don't think I'm maybe quite an influencer. I don't think I've reached quite that height of celebrity yet, but I appreciate that people listen to me sometimes.
So because where part of that discussion came from was when you polled the group about what the number one sort of issue was amongst pediatricians coming out of the COVID pandemic, which when you did your word cloud kind of settled on mental health, if I have it right.
Yes.
Do you think that as a CMA president over the last little bit, do you think that's resonating throughout the specialties and throughout medicine, or is there something else?
I think it definitely is. I mean, when you look at just the information we're getting when we're looking at some of the work CMA's done on understanding what the health of Canadians looks like right now, right? We've seen an increase in mental health concerns across the population. 1 in 4, 1 in 3 people reporting mental health concerns. So I think we're seeing that. And so I think certainly any of us who deal with people kind of in that holistic way, if you're a family doctor, you're a pediatrician, I think all of us are seeing the impacts of mental health. I think it's a huge part of what's straining our system because it's really changed, I think, a lot of people's jobs. We're not, even for me, thinking being in pediatrics now for over 20 years, the volume and the pressure and the complexity of mental health problems is a lot different than it was when I started in this job. And I think that's why our training programs don't really put a lot of emphasis there. It's not traditionally, I don't think, been considered necessarily the wheelhouse of a pediatrician, at least not the level that you need to be able to do it at now, right? Whereas now I think it'd be very hard to be in community practice without significant skills in psychiatry and mental health because those psychiatrists for most people aren't very accessible. And so you really do need to be able to manage these problems, and not just the straightforward ones, the complex ones. So I think we're aware of that more and more. I think because the system isn't really set up very well to help folks with mental health problems, that makes it even harder for docs because it lands with us. We don't always have the right resources, especially when people can't afford therapists and even sometimes not able to access pharmaceutical interventions that might help them depending what their diagnosis is. So I think it's very much out there. And I think because these are not problems that are simple to solve, right? They tend to be chronic. They're usually rooted in things like trauma and developmental trauma, adverse childhood experiences. And they often involve the whole family, right? It's not the same as having a sore throat or a broken leg. So I think it is going to pose a big challenge to our system. And the other thing I've been thinking a lot about lately that kind of links to this is, I often reflect on the fact that I think one of the biggest mistakes we've made in medicine is how we've sort of defined mental health and physical health as two different things, right? They're almost two distinct silos. There's mental health and there's the rest of your body. It's like we kind of cut ourselves off at the neck and go anything to do with the brain that's not, a stroke or a tumor, that's somehow disconnected from the rest of their body. And I think what that's led to is a real lack of appreciation of the impact of the mind-body connection and how real that is. And I've noticed a lot lately, I think particularly as people are trying to understand long COVID, when I just see the dialogue around that, particularly coming from the public, what I realize is there's some strange shaming that's happened there where people feel like if you're trying to talk to them about their mind-body connection, you're diminishing their concerns, or you're saying it's not real, or somehow that's less of a diagnosis than physical one. And again, the fact that those things often coexist. And I think arguably for anybody with a chronic medical condition, there's always a component of mind-body connection and how they experience that illness and how it manifests for them. And I think we're starting to understand this a lot more in things like chronic pain and other somatizing type disorders. But somehow it's so stigmatized that people, even the public, feel like it's not real. So what do we do about that? I think that also comes from us, but I really worry we've done the public a huge disservice there because there's like this huge pushback in wanting to understand that the mind-body connection is real. It's as real as anything else. But I don't know how we sort of shift our thinking on that.
Yeah. I mean, in our training, it was sort of the fibromyalgia, sort of air quotes. It's like her jazz hands, and they have this that we don't understand, which now we understand that a lot more. I mean, and I completely agree, but I feel like long COVID is sort of that eye roll time right now where we're like, oh God. And it's probably out of fear and somewhat self-preservation that we're saying to ourselves, like, well, I don't know what to do about that. So if I can make it less real and more about them, then somehow that's, I don't know, a survival tactic. But we do know so much more now, and it's such an opportunity for medical education, for, not to be cheesy, but faculty development about how we can teach that better, how we can model that better for learners and for kind of upcoming people.
Oh, 100%. And to me, it's really about walking these two paths together, right? And I totally agree. I think we're starting to understand some of these chronic medical conditions that people have a lot better from the science lens of them, like what's actually going on in the body, what might be causing these things. We're starting to understand that more and how to treat them. But I think, we also have to understand that there's always going to be a mind part or a psychological aspect to how people experience chronic illness as well. And I think the patients that do the best are when we walk those two paths together. And I think, unfortunately, right now that rarely happens. And it actually leads to a lot of suffering that could have been alleviated if we took that sort of perspective more early on, and we all felt more skilled in that regard. And that definitely worries me, because I totally agree with you. I just think there's such an onslaught of things coming, and I feel like in some ways we're losing trust with the public, and people are shying away from wanting to engage because they don't feel seen or validated. And like, how do we navigate all this complexity and knowing again that takes time, it takes rapport, it takes relationship. At the same time, we're losing a lot of people from primary care and longitudinal medicine. And what does that mean given the complexity of the illness profiles in front of us? I think there's lots of challenges. Also, though, like lots of opportunities, because as you said, if we sort of reframe the way we teach these things, the way we think about them, the way we practice, then I think we can be much more effective as providers. And I think that's why fundamentally I also feel so passionate about the idea of people understanding trauma and what that means, because I think that's another shared lived experience that almost all humans have. And if we could, again, understand better how that impacts people and their health, I think we could do a much better job at caring for other people and also arguably for ourselves.
Right. Well, it's such a tenet of social pediatrics that we shouldn't be doing this alone. We can't do this alone. And so if we could really redefine what the actual problems are for people, and I don't even think it's fair to say problems, but just sort of the actual person in their complete self, then we'd stop listing their problem list, right? Like you say,
totally.
Of like, acute, congestive heart failure and like diabetes. And then it's like, and other complex psychosocial problems. Like I would never do a list like housing, can't pay for their medications, child abuse, and a whole bunch of other medical complications, like you couldn't ever summarize those things, in a way by which you couldn't unpack them and try to make a difference. And in social peds, we're really lucky because the model is about advocating for other people to help you. So like sometimes you're having people help you. And I think that's the future of medicine, is that to think that we can do this alone and play all of these roles for people is short-sighted, but, and keep ourselves well, like you say, and, not just a flash in the pan. Like we have the lasting power to stay in our career and be there for people.
Yeah. Oh, absolutely. And I think it's like so important too, what you're saying is that we elevate these other things that people deal with to be equivalent to these other concerns, right? Like if you have migraine headaches or you have a brain tumor, that we also need to consider, if you're unhoused or you're living in poverty as equivalent to that. It's going to have a very real impact on your health, but somehow it's kind of like the secondary thing, right? Just as you were saying. And I think until we switch our thinking about that, we're never really going to see people as complete people or be able to address holistically their concerns. And it shouldn't, of course, be the role of a physician to do all those things. But it often lands with us because we're often the only part of the healthcare system that's free. And we need to be rethinking those investments.
Totally. So then how do we keep ourselves well? Katharine, the CMA's made a huge commitment to wellness and physicians over the last couple of years. You guys must be proud of that.
I think it's really wonderful to see so much more dialogue and deep understanding and deep thinking, I think, going on about physician wellness and what that means. I think it's important on so many levels, right? It's important for individual physicians because I think each of us have a right to find joy in our lives and be happy and productive in this very important work. It shouldn't be either or, right? It shouldn't be, I'm either a good physician or I'm a happy, balanced person. We should be able to be both those things. So I think that's really important. And I think also of critical importance is that recognition that physicians who are unwell are not going to be as effective at providing care. They're not likely to retain in their work. You're going to have more attrition and loss of expertise. But also there's a real risk of harm to patients and medical errors and poor care that costs the system. So these things are all interrelated. And I think when we can elevate the importance of this issue to make it that systems level thinking, there's more opportunity for buy-in and commitment to it. And I think that's really the future of this area. We've got to understand what it is, where does burnout come from, what is burnout? And I think you could frame it as just another form of trauma, right? For most physicians, their burnout is really a set of collective traumas that they've experienced in the system, both from the system, from colleagues and trying to care for patients, all those things cause trauma. And then often they're in a system that can't respond to their trauma. So they're, coming looking for solutions, trying to get people to help them. That doesn't always happen. And that's re-traumatizing. And that's often, I think, where burnout's coming from. So I think the reality is our wellness is linked to the systems transformation that we need. And it's linked to the thinking we were just talking about, which is really looking at team-based care, expanding who's on the team, sharing the burden of this work and creating opportunities for a workplace culture and a healthcare system that looks at people holistically and also physicians and invites us to be healthy and prioritize ourselves while we care for others. And I think if we can be doing all those things, we're going to really improve the care that people get. And I think when you do a good job and you're doing a good job, you also then reap the reward of that positivity, and that's going to fuel healthier physicians. But that's going to take different leadership. It's going to take a different way of looking at these challenges. And this is why I love that we're talking so much about trauma and trauma-informed care in our world of pediatrics, because I think it expands to this concept of physician wellness, right? How do we be trauma-informed in our systems, not only towards patients, but towards each other?
Mm-hmm. Absolutely. So when you write your book, I don't think I'm giving a spoiler because I made this up. And maybe you can
This was your idea.
It was I will always take credit for it. So are you going to call it Psychiatrist by day, intensivist by night, or my preferred title, which is The Leader We Wanted But Didn't Know We Needed?
Well, I'm not sure I have enough material for a full book on that topic. Perhaps I could write an essay and then I could do 2 essays, one on each topic.
Oh, well, but you have such a positive, clear, passionate message that I thank you for your leadership and your now friendship. I'm so glad to have met you this year in person. And so now we know each other. And I just love that as women and as leaders and as pediatricians, but just as moms and people throughout this country, that we all kind of gather together and know that we've got each other's back. And that's what the system needs, is for us all to really just have each other's back, I think.
Yeah, I totally agree. And I think it's really about finding your tribe and building that tribe, right? The people that care about the things you care about, and are people just you can go to when you sort of need a pep talk or to commiserate or just to feel inspired. And so I appreciate that you're in my tribe.
Oh, thank you so much for your time today and for coming on the podcast straight from Whitehorse, Yukon, which is amazing. And I love it. And I can't wait to visit there someday. And we hope that maybe someday you'll come visit St. John, New Brunswick. We'd love to have you.
Oh, I would love to come. So I'll consider that an invitation.
Done. Thank you so much for coming today.
Thank you.
Thank you for listening to the Fact Dev Lounge podcast. Please leave us a review on iTunes, YouTube, or SoundCloud, and even a comment on some ideas for future podcasts. Thank you very much and have a great day.